So this is the clavicle. It's a tricky bone to sight, but what's important about the clavicle is that it's an S-shaped bone. It has a lateral flat concave surface, shaft, and then at 2/3 a medial convex surface. What's important is to look at the ends. This is flat and rough, and that is the medial end that articulates with the sternum. This is flat and smooth, and that's the acromion end. So to sight it, I always look for the subclavian groove. This is a bit rough and has a groove surface, and this is smooth. So I would say this is a right clavicle with a medial end articulating the sternum, the medial 2/3 in a convex manner, and then the concave flat lateral third with the acromioclavicular joint formed here. Important to talk about muscle attachments, and on the superior surface there's a posterior and anterior ridge. Superiorly, posteriorly, the trapezius muscle attaches to the lateral third, and along the superior medial portion is the clavicular head of the sternocleidomastoid. On the anterior surface, it's the pectoralis major that has its clavicular head, and then the deltoid, which also has a deltoid tubercle that then inserts here. Important to look at the internal surface, inferior surface, and this is where the subclavian vein passes. Also the divisions of the brachial plexus are given off here, and there's an attachment of the subclavius muscle that then goes on back to the first rib, and it's important that I like to talk about that because that's the distal extent of my axillary dissection. The blood supply to the clavicle has a nutrient branch from the suprascapular artery that comes off the subclavian cervical trunk, and also the clavicular branch that comes off the thoracoacromial artery, which is the second part of the axillary artery. And as we've said before, the subclavian artery, as it passes through the lateral border of the first rib, then becomes the axillary artery, and those branches are then divided by the pec minor, and they're classically 1, 2, 3.